Good afternoon. It's Wednesday, February the 24th, 2021, Pink Shirt Day. Sego, David Lahashu Juts. Welcome to today's COVID-19 Task Force update on this, our 180th show of Kahnawà 911. Today our guests will be Lisa Westaway, the Executive Director of the KMHC, and Lloyd Phillips, Commissioner of Public Safety. And we'll start with Lisa. Lisa?
Thank you. We wanted to have a special Facebook Live today because we are very, very thrilled to announce to the community that the vaccination campaign for mass vaccinations for the community as a whole will start the week of March 8th. So this is wonderful news. Everyone has worked really hard to make this happen, and we are really, really very happy to communicate this to you today. So there are many logistics that will still be worked out and will be communicated to you in the coming week. However, what we do want to give you as information is a few specifics. So vaccinations will take place starting March 11th. So on the 11th, 12th, and 13th, vaccinations will be only for people who are 85 years and older. This is exactly as the vaccination campaign is starting in all of the Montérégie area. So you'll see that week 85 plus being vaccinated throughout Montérégie. It will be the same in Kahnawà for that week only. And therefore, March 11th, 12th, and 13th. We will be providing you with information about how to book an appointment next week. Appointments will mostly be booked online or by calling KMHC, and so that information will come to you directly next week in a specific communique. Starting the week of March 15th, we will be vaccinating the community as a whole. So, of course, once we complete 85 and older, we will move on to the rest of the community. And again, you'll get details on booking procedures very, very shortly. For the week of March 8th, so 11th, 12th, and 13th, the schedule will also be coming out shortly. But what we do want to advise the community about is that any person that is accompanying an 85 plus year old who is 70 and up will also be vaccinated. So there are very, very specific rules that first week because we do have to follow the Quebec guidelines just for the first week of vaccination. So any person who's accompanying someone who's 85 plus who is 70 and older can also be vaccinated. We also will be able to make special arrangements for anybody who is not able to make it to the bingo hall on their own. Medical transport has very gladly volunteered to transport any community member who requires assistance, and so we'll be making those arrangements with each individual in person as required. So again, we're very happy to give this information to the community. We still are awaiting specific confirmation about type of vaccine. What I can tell you is on March 11th, 12th, and 13th, for 85 plus, the vaccine that we will be using is Pfizer. Starting the week of the 15th, we expect the vaccine to be Moderna. However, we're still not 100% sure. I should have more information by the end of the week. However, we do expect the mass vaccination campaign to be with Moderna vaccine. And we still do not have a lot of information about second doses. So that may be a question that you're going to be asking yourselves or that you would like to ask us. Second doses, Quebec has confirmed that they will be providing second doses at this time. However, there are still studies being conducted looking at the length of time between first and second dose that is acceptable, and there have been no definitive plans about when that second dose will happen. At the current moment, we do know that 90 days is acceptable, but again, we still do not have information about the second dose, but we do expect it to happen. So let's get through this first dose. It's very important. Again, our vaccination website has frequently asked questions, so if you are concerned, if you have questions about whether you should be vaccinated or not, many questions are answered by Dr. Gauthier on our website, on the frequently asked questions document. If you have a specific medical condition and you are very worried, please speak with your physician. Our goal is to vaccinate 80% of the population. Remember, this is a collective responsibility. We cannot force anyone to be vaccinated, of course, and we do not wish to force anyone to be vaccinated, but we do believe that this is a safe process. Many healthcare workers, residents of our long-term care facilities have already been vaccinated and are doing very well. So this is a very safe method for the general population for us to move forward out and move away from COVID measures. Again, just a reminder though, after the first dose, we do have to maintain our measures of distance, hygiene, masking, and checking in on our well-being, ours and those of our friends and neighbors. So this is really exciting news. You'll have more details in the coming days, and we thank you for collaboration and patience as we move through this process. Thanks.
Thank you, Lisa. Definitely some great news for the community. And coming up next is the Commissioner of Public Safety, Lloyd Phillips. Lloyd.
Thank you very much, Lisa, for that presentation and certainly giving some very positive news to our community. And thank you, you and your team, for all the hard work that got us to this point where we actually now have a launch date of vaccinations, mass vaccinations within our community, starting on the week of March 8th. So again, just to reemphasize some of the key points that Lisa had made, we definitely want to get 80% plus of the community vaccinated. So we are going to be providing much more information to you over the next few days. We will have as much information as you may require. But as we said several times, there's that light at the end of the tunnel. I think today that light has got much brighter. And we do now have that date where we can start looking forward to getting that first dose of the vaccine. And as you may know, for many people, the first dose does provide a significant immunity, based on one dose only. So very positive news. We are in the process of turning a major corner in the pandemic response in our community. And we got to hang in there just a little bit longer. We're moving forward. A collective effort to get people vaccinated. A lot of logistics to be worked out. A lot of collaboration and cooperation with many community organizations, and to make sure that the operations of the vaccination center is going to be done professionally, smoothly, and effectively. So I just want to re-emphasize those messages to the community. So we are at that brink where we're ready to turn that corner, and certainly very positive news. Hang in there. We'll be in touch and talk soon. Kahnawà.
Thank you very much, Lloyd. And that's it for today's program. Great news for the entire community, and hopefully we'll see you at the vaccination center very soon. Just a reminder, for tomorrow night, we will not be having Facebook Live, so you'll be able to join us again next Tuesday, or if something else comes up and we need to communicate to the community, we will reach out to you. And that's it for our television program today. From all of us here, Yawagoa, Danu, Kahnawake.